You poured it this morning, before you even sat down. Before the day started, you grabbed the bottle from the refrigerator door, or you opened the carton, or you tore open the wrapper on the thing you buy every week because the label says natural and made with real fruit, and you consumed something. And inside your body, in the two organs sitting quietly just below your ribcage right now, something began. A chemical process. A cascade that ends, years from now, with a type of scar tissue forming inside your kidney that no medication can dissolve, no surgery can remove, and no doctor can reverse. Because by the time that damage shows up on a blood test, 60% of your kidney function is already gone. Here is the number that stopped me cold when I first encountered it in clinical training. 37 million Americans are living with chronic kidney disease right now. Of those 37 million, 90% have no idea. Not 10%, not 30%, 90%. They feel fine. They go to work. They eat what they believe is a reasonable diet, and their kidneys are failing in complete silence. Subscribe to Dr. Henry and hit like. I've spent 15 years watching this happen. I know what's in your kitchen. I know what it does to the organ that keeps you alive. And I'm done staying quiet about it. There is no billing code for this conversation. I'm having it anyway. I want to tell you about Elena. She was 52 years old when she came to see me. An accountant, small woman, careful with everything, careful with money, careful with time, careful with what she put in her body. She had read about the importance of antioxidants, so she drank juice. She had read that low fat was better, so she bought low-fat yogurt. She had read that processed red meat was dangerous, so she'd switched to granola bars before the gym. She was trying. She was genuinely, sincerely trying. She came in for a routine checkup. Her cholesterol was fine, her blood pressure was borderline, but nothing alarming. She felt no symptoms that she associated with anything serious. A little tiredness, but she worked long hours. Some puffiness in her feet by the end of the day, but she stood a lot. I ordered a kidney function panel, not because I suspected anything, because I order it for everyone over 50 as standard practice. Her GFR came back at 38. Her urine showed protein where there should be none. Her kidneys had lost more than a third of their functional capacity, and she had felt nothing specific. Nothing that pointed here, nothing that said, "Look at this organ." I sat across from her at the follow-up appointment. I told her the results. She stared at me for a long moment. Then she said, "But I eat well. I've been eating well for years." I asked her to walk me through a normal day, what she had for breakfast, what she drank, what went on the food she cooked. Morning, a glass of orange juice and a fruit yogurt. Lunch, a salad with commercial dressing, sometimes a sandwich on packaged bread. Before the gym, a granola bar. Dinner, pasta with sauce from a jar, sometimes ketchup on the side. She was not eating badly, not by the standards most of us use. She was, however, consuming between 60 and 80 grams of a specific substance every single day. A substance that your kidneys process differently than anything else you eat. A substance that sets off a chain reaction inside kidney tissue that, over time, creates scar tissue where living filtering cells used to be. Elena had been doing this for years. Every morning, before she even sat down, she had been unknowingly damaging the two organs most responsible for keeping her alive. I'm going to show you exactly what that substance is, exactly how it works, and exactly what you need to do. But first, you need to understand what we're dealing with. Because until you understand what the kidneys actually do and how silently they fail, the rest of this won't land with the weight it deserves. Your kidneys are extraordinary organs. Right now, while you sit here, while you breathe, while your mind processes these words, all 5 to 6 liters of blood in your body are passing through your kidneys approximately once every 20 to 25 minutes. They filter it. They extract the waste products of metabolism, the excess minerals, the chemical byproducts of everything you've eaten and produced and processed. They route it all out through your urine. They regulate your blood pressure. They manage your fluid balance. They produce the hormone that tells your bone marrow to make red blood cells. They activate vitamin D. They control the sodium and potassium levels that keep your heart beating in a regular rhythm. None of this requires any conscious effort on your part. You don't feel it. You don't manage it. It just happens. Every minute. Flawlessly. And here is what makes the kidney uniquely dangerous to damage. Each kidney contains approximately 1 million tiny filtering units called nephrons. A nephron is microscopic. You could line up several thousand of them across the diameter of a single coin. But together, 1 million nephrons per kidney create a filtering surface of extraordinary capacity. They have enormous redundancy built in. The system is designed to keep working even when large portions of it are damaged. We measure kidney function with something called GFR, glomerular filtration rate. Think of GFR as the dial on a gauge. The gauge tells you what percentage of your kidney capacity is still functioning. A GFR above 90 is excellent, above 60 is acceptable. Below 60 is the threshold where we diagnose chronic kidney disease. Here is the fact that keeps nephrology specialists awake at night. By the time a person's GFR drops to 30, by the time they have lost more than half of their kidney function, the vast majority of them still feel nothing. No specific pain, no symptom they would identify as kidney-related. Maybe some tiredness, maybe some mild swelling they'd attribute to standing all day. Nothing that says something is seriously wrong here. The kidneys have a clinical saying among specialists. They don't complain until they've lost 2/3 of what they have. 2/3. And by then the damage that caused the decline is years old. Years of something happening, daily, silently, below the threshold of anything you would notice or name. Elena's kidneys had been losing ground for years before she sat across from me in that office. Every single day of those years, she had breakfast. She went to work. She went to the gym. She came home, cooked dinner, watched television, went to sleep. And while all of that was happening, the organ she never thought about was fighting a losing battle against something sitting on her refrigerator shelf. Let me tell you what it was. It is not salt. Salt is real and it matters, and I'll come back to it. But salt is not the hidden one. You've heard about salt. It is not alcohol. Most people reading this don't drink heavily, and those who do already know the risk. The substance is fructose. Specifically, added fructose, high fructose corn syrup, and sucrose, the kind that has been added to processed food in quantities that no human body evolved to handle, and that is now present in approximately 70% of every packaged product in a Western supermarket. 70%. Not some niche ingredient in specialty products. The substance in most of what is sitting in your kitchen right now. Let me explain what it does, because the mechanism is the thing. Once you understand the mechanism, you understand why this is different from every other food risk you've been told about. Glucose, the sugar from bread, pasta, potatoes, rice, is processed throughout your body. Every cell can use it. Insulin opens the cellular door, glucose enters, the cell converts it to energy. The system is orderly, distributed, managed. Fructose is different. Your cells cannot use fructose directly. It travels to your liver, and your liver begins processing it through a specific metabolic pathway. During that process, something happens that doesn't happen with glucose. The processing rapidly depletes a molecule called ATP, adenosine triphosphate. ATP is your cell's primary energy currency. Think of it as the power in a battery. Fructose metabolism drains that battery fast. When ATP is depleted rapidly, the cell produces a byproduct. That byproduct is uric acid. Uric acid. You may know that word from gout, the painful joint condition caused by uric acid crystal deposits. But uric acid doesn't only damage joints. When it's produced in large quantities, and the kidneys attempt to filter it, Something specific and documented happens inside the kidney tissue itself. Inside the tiny tubules of the kidney, the microscopic tubes through which filtered fluid passes before becoming urine, uric acid crystals begin forming. Research published in the Clinical Kidney Journal in 2023 by researchers at the Karolinska Institute in Stockholm documented this in detail. Uric acid activates inflammatory pathways inside the kidney's tubule cells. It generates oxidative stress, chemical instability that damages the cellular structure from within. It signals inflammatory immune cells to infiltrate the kidney tissue. And over time, the space between the kidney's functional units fills with fibrous scar tissue. That condition has a name: tubulointerstitial fibrosis, and it is irreversible. The scar tissue does not dissolve when you change your diet. The nephrons it has surrounded do not recover. Every nephron lost to that fibrosis is a permanent subtraction from your kidney's capacity to filter blood. Elena had been building scar tissue in her kidneys for years. The orange juice in the morning, the flavored yogurt, the dressing on the salad, the pasta sauce, the granola bar. None of it tasted harmful. All of it contained fructose in amounts that, added together over years, had created measurable permanent damage to a 52-year-old woman who thought she was eating well. And here is what I want you to sit with for a moment. Research from the NHANES database, the National Nutrition and Health Survey tracking thousands of Americans over years, found that consuming 2 or more servings of sugar-sweetened beverages per day was significantly associated with a measurable increase in albuminuria. Albuminuria is protein in the urine. It is the first sign that the kidney's filtering membrane is failing. 2 servings, a glass of juice and a soda. Not a remarkable amount. An amount that is, for millions of people, a completely ordinary Tuesday. Now I want to walk you through your refrigerator. Not a theoretical refrigerator. Yours. The soda is obvious. I'll say it and move on. A standard 12-ounce can contains roughly 39 grams of sugar, almost all of it high fructose corn syrup. High fructose corn syrup was introduced commercially in the 1970s because it was cheaper, it didn't crystallize, and it could be blended into almost any product without changing the texture. Within 3 decades, it had saturated the food supply at a scale no previous generation in human history had encountered. Your grandparents didn't eat this. Your parents barely did. You have eaten it every day of your life. But the soda you already know about. I want to give you the ones you don't. The ketchup on the door of your refrigerator. A tablespoon contains roughly 4 grams of added sugar from high fructose corn syrup. You put 3 tablespoons on the plate, 12 grams before you've touched the main course. The salad dressing. Honey mustard, balsamic vinaigrette, light ranch. 5 to 7 grams of added sugar per serving. You've had a healthy salad with a fructose load comparable to a small candy bar. The pasta sauce in the jar. 8 to 12 grams of added sugar per half cup. The sugar is there to neutralize the acidity of the tomatoes and to make the product more palatable, so you keep buying it. The jar does not tell you this. The bread in the square bag, the standard commercial loaf. 2 to 3 grams of added sugar per slice. 2 slices for a sandwich, 2 sandwiches a week, for 20 years. Do the calculation yourself. And then there is the one that catches the people who think they've already solved this problem. Flavored yogurt, fruit yogurt, low-fat yogurt, probiotic yogurt with the image of a strawberry on the label. A standard 6-ounce container contains 19 to 26 grams of added sugar. More sugar than a small bag of gummy bears. Sold in the health food section. Marketed to people who are trying to take care of themselves. This was Elena's breakfast, every morning, consciously chosen because it seemed right. Now, I want to address the objection I hear every time I get to this point, because someone is thinking it right now. But fruit is natural. Fructose from fruit is fine. The fructose in my orange juice came from oranges. This is partially true, and the distinction matters enormously. When you eat a whole orange, the fructose inside it is accompanied by fiber. The fiber physically slows the rate at which fructose is absorbed from your intestine into your bloodstream. It acts as a buffer. The metabolic consequences, the rate of uric acid production, the load on your kidneys, are significantly less severe. Whole fruit for most healthy people is not the primary problem. Fruit juice is not fruit. When you juice an orange, you remove the fiber entirely. What remains is liquid sugar that reaches your bloodstream at nearly the same speed as soda. A standard glass of orange juice contains 21 to 25 grams of sugar. The label says 100% natural. The biochemistry inside your kidney tubules does not care what the label says. Elena drank a glass of orange juice every morning because she believed she was doing something good for herself. It was the first thing she consumed every day. And it was, every day, triggering a uric acid cascade in the kidneys of a woman who was simultaneously making all the other choices she thought were right. Write this down. If it says juice, it counts as a sugar load. If it says fruit-flavored, read the ingredient list before you buy it again. And if that ingredient list contains corn syrup, high fructose corn syrup, fructose, glucose-fructose syrup, invert sugar, or fruit juice concentrate, any of those phrases, you are reading different names for the same substance. The food industry has approximately 60 documented alternative names for added sugar. Most of them contain fructose. Most of them will not be immediately recognizable to someone scanning a label quickly in a grocery aisle. There is a second substance I need to cover, and I want to be precise about the risk because precision matters here. Phosphate food additives, inorganic phosphorus, added to dark-colored sodas, processed meats, packaged breads, and many flavored products for texture, preservation, and shelf life. It appears on labels as phosphoric acid, disodium phosphate, sodium phosphate, calcium phosphate. Phosphorus is essential. Your body needs it. In healthy kidneys, excess phosphorus is filtered out and excreted in urine without issue. In kidneys with even mild early-stage damage, the kind Elena had, the kind 37 million Americans are carrying without knowing it, the filtration system is compromised. Phosphorus accumulates in the blood, and elevated blood phosphorus triggers the production of a hormone called FGF23. In small amounts, FGF23 is your body's regulation signal for phosphorus balance. In elevated concentrations, sustained over time, FGF23 has been independently associated with accelerated progression of kidney disease and significantly increased cardiovascular risk. Here is the detail that changes the math. Organic phosphorus, from chicken, from eggs, from beans, is absorbed at roughly 40 to 60%. Your intestine does not fully absorb it. Inorganic phosphate from food additives is absorbed at up to 100%. It goes in almost entirely, every molecule. And the kidneys that are already struggling to keep up receive the full load. If you have perfectly healthy kidneys, this is manageable. But the person who already has reduced kidney function and does not know it is taking that full inorganic phosphate load on an organ that cannot handle it. The last threat technically lives in your medicine cabinet. But most people reach for it in the kitchen, at the dining table, with a glass of water. Often daily, sometimes twice a day, for years. Ibuprofen, naproxen. The class of medications called NSAIDs, non-steroidal anti-inflammatory drugs. I want to tell you about Martin. Martin was 61 years old, a retired electrician with a bad back, the kind of back pain that comes from decades of physical work, from bending and lifting and crawling into spaces that weren't designed for a human body. He'd managed it for years with ibuprofen, not prescribed, over the counter, the kind you pick up without speaking to anyone. 2 tablets in the morning if it was a bad day, 2 more in the afternoon if it didn't ease up. He'd been doing this on and off for 7 years. He came to see me not for his back, but because his daughter had noticed his ankles were swollen. He thought it was from the heat. His GFR was 29. He was one step from dialysis. He had stage 4 chronic kidney disease. And he had taken ibuprofen that morning before driving to my office. Here is the mechanism. Your kidneys, at baseline, produce compounds called prostaglandins. Prostaglandins perform many functions throughout the body, but inside the kidney, they have one critical job. They keep the blood vessels supplying the kidney dilated and open. They are the signal that says, keep the flow running, keep this organ supplied. NSAIDs work by blocking the enzyme that produces prostaglandins. That is their mechanism of pain relief. They suppress the inflammatory prostaglandin cascade, but they do this everywhere in the body simultaneously, not only at the site of your back pain or your headache. In the kidney, blocking prostaglandins means blocking the signal that keeps renal blood vessels open. The vessels constrict, blood flow to the kidney decreases, the nephrons receive less oxygen, they begin to experience ischemia, insufficient blood supply. In a young, healthy person taking a normal dose for a few days, the kidneys compensate. The risk is low and well documented as low. I'm telling you this honestly, but in a person over 55, in someone who is even mildly dehydrated, and mild dehydration is chronic and extremely common in older adults, whose thirst response has weakened with age, in someone with elevated blood pressure, in someone with even early undetected kidney damage. In that person, what Martin was doing, 2 tablets in the morning, 2 in the afternoon for 7 years, was repeatedly applying a documented mechanism of kidney injury to an organ that was silently losing ground. Research published in Pharmacology Research and Perspectives found that NSAID use for more than 14 days was associated with a measurably higher risk of nephrotic syndrome, a condition where the kidney's filtering membrane becomes damaged enough to leak protein into the urine at an abnormal rate. A separate analysis of over 7,000 NSAID-associated kidney injury cases found that ibuprofen accounted for nearly 47% of them. The median onset of measurable kidney injury, 6 days. Martin sat in my office looking at his numbers. He was quiet for a long time. Then he said, "Nobody told me that tablet could do this." No one had. It was over the counter. It said safe on the label. He had been taking it for his back and destroying his kidneys for 7 years without a single conversation with a single medical professional about what it was doing to the organ that filters his blood. I am not telling you to never take ibuprofen. I am telling you, if you are taking it regularly, more than once or twice a week, and you are over 50, or you have elevated blood pressure, or you are often underhydrated, then you are applying Martin's mechanism to your own kidneys, and you deserve to know that. If chronic pain is driving this, ask your doctor explicitly, what is this doing to my kidney function? Ask for a creatinine test. Ask for your GFR. These questions will not be volunteered. You have to ask them. I said at the beginning that the kidneys are silent. That is largely true. But they do send signals, small ones, early ones that people attribute to other things and learn to ignore. Here is what to look for. Foam in the toilet bowl after urination, not occasional bubbles. Persistent foam that lingers. When you see that consistently, what you may be seeing is protein in your urine. Protein molecules that belong in your bloodstream are leaking through the kidney's filtering membrane. That is albuminuria. It is detectable on a simple, inexpensive urine test long before anything unusual appears in a standard blood test. Elena had it. She had never been tested for it. Swelling in the ankles and feet, particularly at the end of the day, or in the face in the morning. This is fluid that the kidneys are no longer clearing efficiently. It settles in the tissues. People attribute it to standing, to flying, to the heat. Sometimes it is those things. If it is consistent and unexplained, have it evaluated. Fatigue that doesn't improve with sleep. A heaviness rather than a tiredness. The kidneys produce erythropoietin, the hormone that tells your bone marrow to generate red blood cells. As kidney function declines, Erythropoietin production declines with it. Red cell counts fall. Less oxygen reaches your tissues. The result is a persistent low-grade exhaustion that rest doesn't fix. People call it aging. Sometimes it isn't. Blood pressure that is gradually climbing and increasingly difficult to control. The kidneys regulate blood pressure. When they lose function, pressure rises. When pressure rises, kidney damage accelerates. This cycle, once started, drives itself forward. None of these alone is diagnostic. Any combination of them, in a person who is over 45 and has never had a kidney function test, is a reason to pick up the phone tomorrow morning and ask for 3 specific things: serum creatinine, eGFR, estimated glomerular filtration rate, and a urine albumin to creatinine ratio. Together, these 3 results give a complete, accurate picture of where your kidneys actually stand right now. They are standard tests. They are generally covered by insurance. They are not complicated. But they will not be automatically ordered at a routine visit. You have to ask, "I want to go back to Elena, because I don't want to leave you with only the weight of what can go wrong. I want to leave you with what actually happened." After that first appointment, she sat with this for several days. Then she came back and said, "Tell me what to do." We didn't overhaul her life. We didn't create a diet she couldn't maintain. We changed 5 specific things. She replaced the orange juice with water and a piece of whole fruit. She replaced the flavored yogurt with plain yogurt and her own fresh fruit on top. She started reading ingredient lists, not every ingredient, just the first 5, and putting back anything that listed fructose or corn syrup in that top 5. She replaced the commercial pasta sauce with canned tomatoes she seasoned herself, which took 15 extra minutes and cost less. And she had a conversation with her GP about the paracetamol she'd been taking for occasional headaches, confirmed it was a better choice for her kidneys than ibuprofen, and stopped keeping ibuprofen in the house. That was it. No supplements, no detox protocol, no dramatic intervention. 12 months later, her GFR had stabilized. It hadn't dropped further. The albuminuria in her urine had reduced. The scar tissue that was already there, that was still there. That doesn't undo. But the progression had slowed significantly. The cascade that was quietly narrowing the window of function she had left was no longer running at the same speed. She called my office to tell me the results before I'd seen them on the system. She said, "I don't feel like I'm waiting for something bad to happen anymore." That is what this is about. Not perfection, not reversal of what cannot be reversed. The ability to walk back into your kitchen, make 5 specific changes, and give 2 extraordinary organs the real chance they've been asking for, silently, without complaint, for years. 5 steps. Clear, specific, and realistic. Step 1. Audit your refrigerator door tonight. Pick up every bottle and jar. Read the first 5 ingredients. If you see high fructose corn syrup, fructose, or fruit juice concentrate, that product is a regular daily source of kidney-damaging fructose. Replace it. Mustard instead of ketchup. Olive oil and vinegar instead of commercial dressing. Canned tomatoes instead of jarred sauce. These swaps are not expensive. They are not complicated. They simply require the decision to make them. Step 2. Replace juice with water or tea. Not permanently, not dramatically. Start tomorrow morning. If you want the fruit, eat the fruit. Keep the fiber. The fiber is the difference between a manageable dose of fructose and a daily kidney load. Step 3. Before you buy anything in a package, read for phosphate additives. Phosphoric acid, sodium phosphate, disodium phosphate. If they appear in a dark soda or a processed deli meat you buy regularly, you now know what that means and you can make a different choice. Step 4. Take stock of your NSAID use honestly. How many times per week do you reach for ibuprofen or naproxen? If the answer is more than once or twice and you are over 50, book an appointment and ask for your kidney function to be tested. Ask explicitly. Those words, that test, that conversation. Step 5. If you are over 45 and you have not had a kidney function test in the last 2 years, book one. Ask for serum creatinine, eGFR, and a urine albumin to creatinine ratio. Ask for them by name. They will not be volunteered. The system that manages your healthcare has no mechanism to offer you this unless you walk in and ask. Those 5 steps are not a guarantee. Nothing in medicine is a guarantee. But they are the difference between continuing what Elena was doing for the next decade and doing what she did in the 12 months after she found out. The kidneys do not ask for help. Not at 30% function. Not at 40%. They compensate. They adapt. They keep the gauge reading higher than the reality for years until they can't anymore. And when they finally can't, when the symptoms arrive that are unmistakably kidney symptoms, the damage behind them is the accumulation of years. Years of small, daily, completely reversible choices that nobody named and nobody explained. I'm Henry. I've sat across from Elena and Martin and hundreds of others like them. People who were trying, people who were eating what the label told them was healthy, people who had been taking the pill that the packaging said was safe, people who had never been told any of this, because there is no financial incentive in a system built on treatment to keep people away from the waiting room. What you just heard is not what you will receive at your next appointment. There is no billing code for this conversation. If this video found you at the right moment, if you recognized your kitchen in what I described, if you saw your own morning in Elena's, then share it with a parent, with a partner, with a friend who drinks juice every morning and has never thought about what it's doing below the rib cage in the 2 organs that do not complain until the damage is already done. Help Dr. Henry reach 100,000 subscribers. Subscribe, leave a like. We are building something the healthcare industry has no interest in building. Every single one of you is part of it, and every single one of you deserves to know what's actually in your kitchen.